So I love neurology. Neurology is probably the best and most interesting field of medicine for me. It takes care of the command center and all the signals that are happening to the body. And the things that let you move, the things that let you think, the things that let you speak. What I really was drawn to and what I liked the most was talking with the patients and figuring out the mystery behind why they were there and figuring out the best next steps forward. The ones that are most rewarding are the ones where I find something that no one's caught for many years, and that's sometimes what happens in neurology, where a lot of other providers are trying to figure out exactly what's going on with someone. But then when you end up in my office and after a whole bunch of other people have stared at you and come up with all these different conclusions, and suddenly that years of workup makes sense and all of it gets better, that's the most rewarding for me. And that does happen, and it's great. So those are the kinds of interesting, super rare cases, Dr. House-like, that I kind of pull through all the different data that we've gathered, figure out a conclusion, and then find something that works. Oliver Sacks, one of the famous neurologists that in the past has said the patient will tell you their diagnosis, and that's true because when you're telling a story, that is how you figure out exactly what's going on. It's really the details that make the diagnosis, and that's my favorite part of neurology. I can treat all sorts of acute and chronic issues, things from chronic neuropathy where you have tingling in your toes, to hemiplegic migraine where you have a horrible migraine on one side of your body and half your body no longer moves, to super complicated seizures that are medically refractory and require deep brain stimulators, to everything in between, Parkinson's movement disorders. There's a whole spectrum of neurology that covers a lot of the different things that drive how you move, how you think, and how you interact with the world. GRMC is a place that I have been very excited to work for a long time. What I really like about it is that this is a tight-knit, family-based hospital where everyone is really not like faking it, totally in cahoots with each other to really move things forwards. I love it. If I could show you on the video, I've got my cowboy boots on right now. And now I'm finally in a place where I can be warm most of the year. And the main reason why I wear the bow tie is if life is not going so great at that moment in time and I open that door and I have a bow tie on, no matter who they are, there's a little smile.